Welcome to today's webinar from the desk of the school nurse, How to Implement a Concussion Management Protocol. I am Carla Giovanniello, Brain Injury Training and Services Project Director here at the Association. Thank you for joining us. Before we begin, a few housekeeping details. Because of limited time, we ask that you please hold your questions until the end of the presentation. During the question and answer session, questions can be submitted via the question text box. The text box option should be visible to you on the GoToWebinar toolbar on your desktop. If you are having trouble viewing this option, please contact Citrix Tech Support at 1-800-263-6317. Again, that number is 1-800-263-6317. This number should also be visible on your toolbar. Our speaker will do her best to answer questions in the order that they are received. Any questions she is unable to address may be submitted via email to the association. We will be recording this webinar session and do plan to post it along with the presentation slides to our website, www.bianys.org. Information about contacting the association and viewing the webinar will be provided in a follow-up email after the presentation has ended. My contact information will also be included in those follow-up messages. Before I turn the microphone over to Patty, let us begin with a quick poll to see who is in our audience today. I'm launching the poll now. Please take a moment to answer the question. I'll give you a few seconds to answer before I close the poll. All right, I'm going to close the poll now and share the results. All right, it looks like we have a fairly diverse group today. I always love seeing that. About 23% of you answered that you're a healthcare professional or caseworker. The majority of you seem to be working in a school setting. And then the second largest number is affiliated with a brain injury program or organization. So again, that's great to see. I do want to thank you all again for your participation and for helping to spread the word about our monthly webinars. Your support, as always, is truly appreciated. It is now with sincere pleasure that I introduce our presenter for today, Patty McLaughlin. Patty is a parent and a registered nurse with 25 years of experience. She is a current member of the staff at Albany Medical Center. Patty also works as a full-time school nurse at Pine Bush Elementary School, where she has been for 6 years. Patty, good morning.
Good morning, Carla. Good morning to everyone and welcome to this webinar, which I hope you will find informative and helpful as the new school year gets underway. I just would like to also thank Carla Giovanniello and Judith Avnar of the Brain Injury Association of New York for giving me this opportunity to share with you something I feel very passionate about, and that is about the safety of our children, especially where it comes to concussions. I would first like to start off with a poll question. Have you encountered or worked with one or more students with concussion-related symptoms?
All right, I'm going to launch that poll question now. Please take a moment to answer. I'll give you a few more seconds to answer before I close the poll. All right, I'm closing the poll now and sharing the results. All right, I did expect to see this, but it looks like the majority of you answered yes, 81% of you. So thank you for taking time to answer that.
Okay, what I thought I would do is start out. I don't know how many of you are from the outside New York area, but in New York, we did institute and implement the Concussion Management and Awareness Act, Chapter 496 of the laws of 2011, which we implemented in 2012. We decided that students who had or may have had a concussion may not be permitted to return to the game in the same day. If they get hurt at the game or whatever sport they're participating in, they should be remained being assessed at the sidelines and not participate in the remainder of the game. A doctor's clearance is required for a return to the sport. It will be recommended that the student would not have full return to the play unless they were evaluated. A form was completed by and written and signed by a licensed physician to meet requirements of the Concussion Management Act. Parents will also be given pamphlets about concussions with permission slips for sports. I can speak from my own experience with starting any sport at the beginning of a season as a preseason prevention. They do review concussion management with the parents at the team meeting, which I find to be very valuable. They use various tools to relay that to the parents in forms of DVDs that don't last that long, and I do think it hits home for a lot of our parents. Schools will also be required to train their coaches and their athletic staff on how to diagnose concussions. Last year in our district we did have the Heads Up for Concussions that's put out by the CDC, which was an online learning for us to have to read, review, and then we had to complete an exam at the end with a certificate that went to our district where we worked. The Concussion Management Act and Awareness Act has specific guidelines. Those guidelines include school staff, such as coaches and teachers, will be trained on the signs and symptoms of concussions and or mild traumatic brain injuries. The importance of proper treatment will be highly emphasized. Number 2, information regarding these causes, the signs and symptoms of brain injury, as well as the treatment that should be available, which you can also find on the following websites: the Department of Health, the State Education Department of New York, or the state education departments within your state, and hopefully on most, if not all, school district websites. Signed consent forms will be necessary for the children to participate in those school sports. And immediate removal, of course, from the activity of a student thought to have a concussion. The student cannot participate without the written consent of the physician in order to re-enter and return to play. The Commissioner of the Education Department and the Commissioner of Health will work well together to establish these regulations related to the brain injury. Now I thought we would move into the area of concussions with another poll question. A concussion usually results in loss of consciousness. True or false?
I'm going to launch that poll question now. Please take a moment to answer. I'll give you a few more seconds to answer before I close the poll. All right, I'm closing the poll and sharing the results. All right, this is great to see. 95% of you answered false, so the majority of you. Thank you.
That was great. That is false. They do not always have a loss of consciousness as a result of a traumatic brain injury. In fact, according to the American Academy of Neurology, a concussion is any traumatically induced alteration in mental status that may or may not involve the loss of consciousness. So I thank you for that result in that question. Now, getting into concussions. Concussion is a mild traumatic brain injury that occurs when a blow or a jolt to the head disrupts the normal functioning of the brain. Some people lose consciousness after a concussion, but most do not, as we just mentioned. After a concussion, the person is often dazed or confused and may not remember what happened. I will now move into the causes of concussions. The causes of concussions usually occur due to falls. They could be struck by or against, a bat or, a strong blow. It's the number 2 cause of injury for children ages 0 to 14. Motor vehicle accidents is the number 1 cause of injury for children ages 15 to 19. Shaken baby syndrome, and sports and recreation-related activities. Note that the following sports that account for the highest number of concussions among children is bicycling, football, basketball, playground activities, soccer, and I do have to tell you that lacrosse and field hockey seem to be gaining in popularity for an increase in concussion injuries, which I think may be due on part by the fact that they actually don't require or have helmets during that field of play, which some experts believe if we do move to that the level of that contact sport may become more aggressive and not a road they think they want to lean towards yet. So it is important, again, that we need to educate our students and our coaches about the prevention and what we can do to safeguard our students. As I get into the signs and symptoms of concussion, it falls into 4 categories: physical, emotional, sorry about that, and cognitive and maintenance. If I just look back at that former slide, you can see I'm not putting in a plug for myself or my son, but I wanted to share with you my experience with my own son, Jimmy, who currently is in his sophomore year at Utica College and is currently playing football. Jimmy first experienced his concussion in his sophomore year playing football. And I have to tell you that when he first had a disruption or a blow to his head, he just sat out on the sidelines. He did not finish practicing. He was removed from his practice and just remained on the side. They assessed him. He never complained of any lightheadedness or blurriness, but following 2 weeks later, he was performing the mile run at school, and he developed some headaches. He felt very dizzy, and he couldn't complete the run. Much to his dismay, he went to the school nurse, and they called me, and he did come home. We did have him evaluated at the physician's office, and they did take him out of football for the remainder of the season. Now, like most students, Jimmy also participates in other sports, the next one being wrestling. So imagine how a mother must feel, or a nurse for that matter, to have her son go from one very strong contact sport to another. He did fine throughout his whole wrestling season, luckily, and we had no other further issues. Following his summer, he did well, and then he started his football season as a junior. And right before that, they actually were able to do the impact testing on Jimmy, which luckily enough our school was able to provide that baseline testing, cognitive function testing for my son before he started. And our district actually does that for all preseason athletes to just get that baseline. And again, this is a tool in which they can measure the cognitive functioning before they are injured or before their sport. Jimmy's second concussion occurred while he was playing wrestling, and he was doing very well, and he was hit into his frontal lobe by his opponent. Jimmy did go down. He did not lose consciousness, although he was dazed, confused. He could not see well. I was not there. My husband was. Jimmy's coach attended to him right away, removed him from the match. He had to forfeit that match. His opponent, fortunately enough, had no injuries at that time, and to my knowledge did not have any injury. I had my husband take my son to the hospital, where he did have a CT scan just to rule out a bleed. Make it known to you, though, that MRIs and CT scans cannot detect a concussion. And the reason why is it cannot be detected by this neuroimaging, because concussion is a functional injury and not a structural one. It can only rule out any bleeding. Diagnosis has to be made by careful examination of the signs and symptoms at the time of the injury. So as I can move on, his physical symptoms were headaches. He never got sick or had any nausea or vomiting. He did have some lack of energy. Constant fatigue was one of his physical symptoms that was ongoing. He ended up losing 2 weeks of school. He had to go back slowly to his full schedule. He started out with some half days and then went on to full days. The initial physical symptoms of dizziness and lightheadedness were there, also loss of balance. They did give him a chance to regain himself after he was injured that second time. He denied any blurred vision. He did have sensitivity to light, and there's always an increase in sensitivity to sounds and ringing in the ears. There also may be a change in the sleep pattern, such as waking up or sleeping too much. The cognitive symptoms that Jimmy did experience was greatly noted in the classroom. He had difficulty concentrating or paying attention. He had trouble with short-term memory and learning. He did have to take some more rest time in between his classes. He would often seek the nurse out to rest for about 20 minutes and then head back to class. Easily distracted, confused, or losing track of the place or time, slower thinking and reacting time, reading and speaking, difficulty multitasking, can't ask them to do too much, and there sometimes will be a lack of organization. With these symptoms, don't always assume that the student will inform you that he or she has suffered a concussion, so it's very important that the teachers be aware that a student has suffered one. Emotional symptoms. You may see mood changes, irritability, anxiousness, or tearfulness, decrease in motivation, easily overwhelmed. They may have a more impulsive personality. They get aggressive. They may have a change in their personality. Their judgment may be altered, and they may have also some tension or anxiety. I can speak for my own son, and that he did become, overwhelmed with his workload. He would get anxious, worried about assignments, and I would say that that was more prevalent with his second concussion. Now moving into maintenance. How has the student's energy level or sleep patterns changed? You must always keep in mind that some of the symptoms may not appear right away. As in Jimmy's case, when he had the first concussion, his symptoms did not appear for at least following the 2 weeks that he was aware of, and it wasn't until he was put into some physical demand to perform physically, like in the mile run, did he realize that he had injured himself more than he had originally thought. So always remember that it may take a little time for them to resume those activities. I do have to say Jimmy's sleep patterns have changed as he has entered his college years, and that he does wake up at night, often sleepwalking. I have to say he might be a little upset that I shared that with you, but I don't always know if that's due to his concussions or if that's just him, but he did not suffer any kind of sleepwalking activity before his concussions. Moving into the statistics of traumatic brain injuries in the United States, they claim there's an estimated 1.7 million people who sustain a TBI annually. Of those, 52,000 will die, 275,000 are hospitalized, and 1,365,000 are released from the emergency rooms. Nearly 80% will be treated and be sent home. A TBI is a contributing factor to a third of all injury-related deaths in the U.S. About 75% of the TBIs that occur each year are concussions or other forms of mild traumatic brain injury. As we continue, I thought I would just cover traumatic brain injuries by age, just so that we can understand the differences. You will note that children ages 0 to 4 years, older adolescents age 15 to 19, and adults age 65 years or older are most likely to sustain a TBI. And like we had mentioned earlier, we do see a strong area of hospitalizations in the 0 to 4 and the 15 to 19 due to motor vehicle accidents. 500,000 of the ER visits for TBI are made annually by children in the 0 to 14 age group. Adults age 75 and older have the highest risk of TBI-related hospitalizations and death. TBI by gender. As you know, in every age group, the TBI rates are higher for males than females. Males aged 0 to 4 have the highest rate of TBI related hospitalizations in emergency room visits and deaths combined. You might be wondering what makes it so different for us to see that our children are most vulnerable, and I just want to point out some of those differences. Children have a greater disposition of head trauma. They have a greater head mass that's relative to their body weight ratio, making them more top heavy. And when they get head weight result in increased momentum during their falls or injuries. Is it right here? Okay. Sorry about that. I seem to have, my sound went out. I was told by Carla, so I apologize if I lost any of you for a while. I was starting to talk to you about why children are most vulnerable, and I'll just reiterate what I just spoke to in case I lost some of you. Children, as you know, have a greater disposition to the head trauma, and the reason why is they have a greater head mass that's relative to their body weight ratio, making them more top heavy, which actually can explain when they get hit, they have more of a rag doll type of effect that occurs. Their neck musculature has not yet fully developed to handle the relatively heavier structure. They have increased head weight, which results in increased momentum during their falls or injuries. Their brain area has more fluid, and they're more susceptible to the wave-like forces. They have thinner cranial bones, which are more easily shattered. I can speak from some experience in that last fall. I had a young girl, 4th grader, who was participating in football outside with her classmates. She, very small girl, she sustained a head-to-head blow with the other student who was bigger than she was. Initially, she didn't, she didn't fall to the ground, but she felt jolted. And she unfortunately came to my office alone, which again, you need to, for those school nurses out there, you need to, or teachers, it's important that you send any child that sustained any head trauma or suspected trauma, either call down for the nurse to come see the child right on the field or wherever the injury may have occurred, or send the child to the nurse's office with someone. She, initially came in. She was very dazed. She was confused. She had got hit on the left side of her head near the ear and was holding her ear when she came into my office. She was very dazed. She was in a fog. She did not remember what happened. She couldn't tell me what had happened. She was trying very hard to fight back those tears because she is a bit of a tomboy-like student. And I kept her in my office and assessed her over, a 20 to 30-minute period of time, notified her parents, and her mother did come pick her up. She had to, she went to the pediatrician. Prior to her leaving my office, though, she did start to vomit. And her mother said she vomited a few more times before she got to the pediatrician's office, where she then did take her to the emergency room. And it was confirmed that she had a concussion. She came back to school 2 days later, and this started early September. She was out of phys ed and all other physical activities until the end of October. So, and I will get into more of that later in my slides. Next, I wanted to just cover the brain growth. They have the greatest percentage of brain growth in children occurs in the first years, birth to age 5. Before age 5 may be the most devastating time for a child to sustain an injury. Children who experience a frontal lobe injury early in life tend to develop long-term psychosocial and behavioral problems. This next slide just gives you the prefrontal cortex and how it has a crucial, growth stage during the teen years, which, as you know, are very vital years, and that's where we see most of our head trauma due to the various types of injuries. Age effects. The age effects of children. Children are just as vulnerable to trauma as adults are, but children may actually look well after the trauma and hide it very well, or may be too scared, may not know what's going on with them. As the child gets older, that part of the brain previously damaged may not work as well as it should. I wanted to take a time to actually look at our different grade level differences. For our school nurses out there, these different age levels, and our educators, you may see differences within these grade levels and how they learn. In the elementary school level, you have to remember that children will complain more about physical problems. They may misbehave in response to the cognitive overload. They will get fatigued, and they may experience some of the other concussive type symptoms, which we mentioned before. When you look at the middle school age, this is a very sensitive age. The students don't want to bring attention to themselves. They often will minimize their symptoms. This is when actually I think some concussions may become underreported because the students are, a little afraid. They may exhibit some signs of difficulty in organizing, setting goals, or planning ahead. This age group, I think, as we know, can be very fragile, and that they are always striving to do well, and they are actually getting into more contact type of play than they did at the elementary school level, which does put them at risk for further injury or the potential of injuries. The high school age. This age can be difficult for children who have concussions because they are very busy. They're a busy age group. They have lots of activities, sports activity, extracurricular activities. There's a lot of demands on their homework. They're starting to think about college. They're involved in multiple clubs, and not to mention all their social activities. And our goal here is that we always want to look to reduce their fatigue, allow them time if they have headaches or any of the other concussive symptoms. For those children that may have had concussions in high school, I think that when they get to the college level, I think we need to stress that it's important that the college student is now considered independent. They're on their own, so they not have that safety net of their parents that is with them every day. They are going on to school, on to college, and they may be even participating in their sport at the college level. I can speak from my own experience with my son Jimmy that prior to his entrance into college, I did fill out an extensive concussion assessment, which I was very impressed that the college actually took out the time and had that as part of their health assessment for an athlete entering college and also a sport. They spent a lot of time on asking questions on if he was ever hospitalized, did he ever lose consciousness, does he experience any post-concussive symptoms, any headaches, difficulty concentrating, cognitively having difficulty with his classes. So I was very relieved as a parent and also as a school nurse to know that there was some follow-up even at the college level. And I do think that we are at a time that the culture is changing. We've had a lot of press from the National Football Federation. The NCAA is very involved. They are all working and striving to take care of our athletes and make sure that they are well taken care of and that they can continue to play with their sport or prevent any further damage down the line for them. Also on the college level, I want to stress too is students, as we know, have to be educated on their alcohol consumption. Which might be something that needs to be addressed because you would not want to, not pick up or notice any changes because they could experience post-concussive symptoms, putting them at risk for another brain injury that could worsen and cause prolonged symptoms for them down the road. Now I'd like to address how school nurses will reap the rewards with good concussion management. I wanted to just touch on the REAP program that actually Karen McAvoy is duly credentialed as a licensed clinical psychologist and a school psychologist in Colorado, and she spearheaded this program in Colorado, which came out of, unfortunately, the death of Jake Snakenberg, and who had suffered a fatal injury, and she is trying to work on preventing the second impact syndrome from occurring by trying to safeguard our students. And she developed this in 2004, and as a result, she has felt that we all need to look at it as a multidisciplinary team approach to community-based concussion management, which is known as REAP. Reduce, educate, accommodate, and pace. First, by looking at reducing, our goal and should always be that the potential of further injury or stress to the brain is the goal here. We want to both reduce the physical and cognitive demands that we may see as they try to recover. Nurses need to obtain a thorough baseline student history that can start at the kindergarten level, especially during registration. You can take that opportunity to talk to the parent, get to know, have they ever had a injury in their years 0 to 5 before entering kindergarten. And then these can be updated with our physical years, grades K, 2, 4, 7, and 10. You also want to make sure that you note and document any underlying medical conditions that a student may have, such as migraines. Do they have a history of depression, a history of mood disorders, anxiety? Do they have any ADHD? Anything that actually may put them at risk, or if they should sustain an injury, may change that picture a little bit. You want to see what happens to them. How often do they get these migraines? What are their triggers? What kind of treatment is the child under? Or what are they allowing for rest? Whatever their practitioner may be doing to help them with these underlying conditions. We need to establish some type of tracking these athletes annually. Most athletes actually do even participate in 1 or 2 sports during their school. They also usually now will spend the whole year on just that one sport. Soccer programs, football programs, they can go all year. These kids are constantly on the go, constantly participating in their sports, not to mention those other types of causes that can put them at risk, such as falls. I don't know about you, but I often will see a student come in on Monday morning, and tell me that they had a sledding accident and they hit a tree. I did have a particular student who this happened to, and I unfortunately never received a call from the parent. I had to reach out to the parent to find out what exactly happened. The student simply came in and just handed me the ER note of the injury. The student came in, she had, a bit of a cut on the top of her forehead, which alerted me to, what exactly happened. It did require me to check with the student every day. She was removed from her phys ed class, and she had to be, watched on after that. Second impact syndrome is something that we need to consider, because they do believe that the second blow to the head, if sustained before the first one is healed, can lead to damaging repercussions of post-concussive symptoms later in life, if not fatal, as with the young man from that Karen McAvoy knew. We need to provide ongoing information and updates with other school nurses through annual conferences that we do hold annually. Then there should always be the continuity and use of protocols and standards should be the same throughout the New York State area or any area that you live in, so that everyone has a continuity and they're following the same type of pattern or concussion management program. Education and collaboration. This one I think is so vitally important, and I really do think that we as nurses are always looking for these teachable moments, as well as educators. It's always important to closely work with our parents, our students, our staff, and physicians to educate them on the signs and symptoms. You should never feel that or assume that people are aware, that they do know what to look for. Our educators, our coaches, athletic trainers, you're spending a lot of time with these students. On the field, you may see subtle changes. I think it's always important to be on the look, observing, communicating, and making any accommodations as they might be needed. Implementing an effective concussion management program using this multidisciplinary team that includes the family, the school physical team, a school academic team, and a school medical team. You can provide adequate resources available through the New York State High School Association, the Brain Injury Association of New York, the CDC. All of these resources provide fact sheets that we can give to parents, give to students, staff, coaches, athletic trainers, and our phys ed teachers on a continuous basis. You want to encourage our parents to advocate for their children in order for them to succeed physically, emotionally, and cognitively, both on the field and in the classroom. As you can see, if you look at this slide on how to use the reprogram, which again encourages a community-based type of management. And I do think that if we all work together, we can have the outcome to be a successful one and hopefully prevent any injury. They do feel that it's really so vitally important that a child, a student, take time and to gradually have a return to play, return to learn. They do feel that 80% of the students, if they're managed well within the first 3 weeks, will have a good recovery and a good outcome. If you look, I know that with time constraints and also for districts, we all have different budgets. We don't all have athletic trainers available to us, and so you can actually kind of suggest that you even reach out to volunteers. It could be a school counselor, a guidance counselor, the social worker. Everybody I know is so busy, and I do know that their workload is very tough, but if you do identify a child that has had a concussion, I think if we work closely, our parents can help us with watching their students, making sure they're monitoring them at home as to their electronic usage, use of the computer, the music, their iPods. They're constantly, their school overload. Children are encouraged to try and scale back when they've developed a concussion, because there's such a sensitivity to the sounds, triggers, lights, the workload. So parents need to also be cognizant of making sure that they're following through at their end, that they monitor their signs and symptoms. The physical team, those are our coaches, our certified athletic trainers. I think the school nurses out there, I think it's important that you reach out to your athletic trainer, athletic director, and speak with them, see how they're managing the concussions, how the students are doing. That can only, widen this net that the reprogram talks about. We need to widen that safety net for our students. The school academic team needs to be highly involved. That would be your teachers, our educators. You can't always assume that the child will speak up and tell their teacher, especially at the high school level and the middle school level. I think those students may be a little bit more timid and don't want to think that they're falling behind or that they need some extra time or extra accommodations. The medical team, our emergency department doctors, I think it's important that we all follow the same rule of thumb, that they are on the same page that we are in allowing students to have time to, go back to return to play, return to learn, that, we are all working together. The primary physician, if they feel that a child is not recovering and is still having symptoms in that 4th week, your medical director or the physician may have to be the one to recommend a neurologist or a clinical neuropsychologist to evaluate the child if they're not recovering as they should. So if you follow this, there is a time frame. Week 1, 2, and 3, like I mentioned before, may be necessary to follow in terms of helping that child or student get back to their baseline cognitive and physical functioning. Accommodate. You need to work closely again with that school team, your teachers, to educate that the student with a concussion may not learn at the same pace that they did prior to their concussion, and they may need more breaks due to their fatigue. You want to reduce the workload if necessary. When we also talk about accommodate, it might be important that in speaking with your teachers, the student may need a separate area maybe to eat lunch. Lunchrooms can be very noisy and may be a trigger for some students, so you may have to find an area or work with the teacher to see where the student could be to decrease that level of sensitivity for them. Talking about their workload, they may need more rest time, they may have to need more time for test taking. It's may be possible that the student may require a 504, an IEP, an individual education plan, if that child is seen to be struggling academically following a concussion. Social media, we are very fortunate that we have social media available to us in a way to further help us monitor our students both in the classroom and also at home. It acts as a good buffer between home and school that the teachers can speak with the parents. The school nurse can also speak with the parents or athletic trainers. All of us as part of this multidisciplinary team can help the child progress back to return to play, return to learn. It may be necessary that the physician may have to be very specific in their accommodations. Some physicians may be very vague. Some may, need to elaborate more on that the child has to be absent from school, or they might need a half a day and then progress to a full day. The student, again, not to, reiterate, but you may want to avoid excessive computer use, texting, video games, the TV, loud music. They may not be able to participate in their physical activity until cleared by the physician, and sometimes for the children that are in the high school, they may need to come up with some kind of adaptive program working with their phys ed teacher while they spend that time recovering. The key to the recovery is going to always be both physical and mental rest. Never forget that. Moving on to pacing. When the student starts out to recover, it's very important that we look at a graduated return to play, return to learn, as their symptoms start to resolve. The success of that, which a student can return to play or learn, requires that there's ongoing, like I mentioned before, communication and collaboration with all of the team, the family, the school team, both physical and academic, and that medical team. It cannot be based solely on one assessment tool, whether it be the computer or paper and pencil, but the whole team, along with, and most importantly, the consultation of the medical director. There was an article that was published in June, just this past June 2013. The American Academy of Pediatrics came out with a new study from Boston Children's Hospital, which looked at the connection between kids with previous concussions and how it may take longer for them to recover. From the study, they found out that children and young adults do take longer if they've especially suffered a previous concussion within a year or repeated blow at any time. Patients with a prior concussion, according to the results of the article, took an average of 12 days. If they didn't have a concussion prior, it took 12 days. If those that may have suffered a concussion prior took more than 28 days to recover. If there was a second concussion within the year, it often took at least 35 days for them to recover. And 60% of the students that they evaluated actually were playing a sport when this happened. So that will bring me on to the school nurse's role. I can't begin to tell you how important the school nurse's role is in identifying a student with a potential concussion, assessing a student who's been diagnosed with a concussion, and the progress at which they return to their school activities. The school nurse may want to establish a daily health office visit in which the student, she can monitor their signs and symptoms for at least 7 days post-injury. Observe for any, because this will help you to observe any late onset of symptoms that may happen, like I had mentioned earlier in my slides, especially in terms of my own son, who it took him a week or so for him to realize that the blow that he suffered did have its repercussions for him. The return to play can be initiated after the student is symptom-free. The nurse wants to assess the students who have suffered a significant fall blow to the head or body for signs and symptoms of a concussion. Again, you want to observe for late signs. You want to assess the student to determine if any of the signs and symptoms require that they go to the emergency room. And as per your district policy, You want to refer your parents, your guardians of students with a potential concussion to their primary care provider. You want to always provide your parents with a instruction on observing for complications that would warrant immediate emergency care. The CDC, the Brain Injury Association, has great information and forms, sheets that provide parents with all those information that they can use to monitor their student better. It's important to develop a tracking tool of student symptoms because this way you can actually develop that daily log of checking with the students, talking to the students. When the injury occurs, it's very important to find out what the impact of injury was. Where did it occur? Was it in the playground? I know myself, sometimes it's helpful to go out into the playground to find exactly where the child was when they fell. Sometimes the teachers aren't able to have eyes everywhere and to observe when the actual fall occurs. Again, you're going to collaborate with your parents regarding their progress at home, especially with, again, their electronic usage and their academic work. The reprogram has in their pamphlet, and also can be downloaded off the computer, this great tool. I don't really feel a need for us to always reinvent the wheel, and I thought this was a really nice way of looking at all the physical, cognitive, the sleep patterns and emotional symptoms that can occur with concussions, where you can fill it out, put your student's name in there, and then there's a section for the names of those people that might be on the team with you. And it could be anyone in the school. I do know that not all schools do have the necessary athletic trainer available to them, or you may have to appoint someone or look for someone to volunteer to be that spokesperson for that child that can connect with you on a daily basis as to how they are doing. Also, this symptom checklist I thought was very good, in terms of you could run off a copy for a period of the 7 days and follow your student through, and you'd come up with a a grid in terms of the how the child is doing, or if they're having any signs and symptoms. The school role is always continuing. We need to communicate and educate your teaching staff. A great time to do that sometimes is at the beginning of the school year, if you have time. I know that the buildings all have a lot to cover at the beginning of the school year, and there's a lot of information, but sometimes if you can just, even if you put in one of the signs and symptoms of concussions in a folder for each of your teachers to have, to be mindful of, playground safety, I think that's important. Sometimes it's possible that our students that we see in grade 1 and 2, if they have sustained a concussion, they may not need some help at that time, but as they get into their grade 3rd or 4, their academic demands become a little bit more difficult, and they may have more trouble with focusing, concentrating, different concepts. So it will manifest itself a little differently than it had. You want to collaborate with your phys ed teacher and review for the graduated return to play protocol. PTA meetings, I think, are a great way to get to know your parents and your school community, and also inform parents about concussion management procedures and the ones that you may have established in your school. Again, the social media, I can't speak enough about that. We do in the Guilderland School District, we do have it as part of our website, the concussion management policy and what we do at our school. Helmet safety is very important. You can drive that home. I know that in my school I have students who take their bikes to school every day. I think it's great, and I do make sure that they all are wearing a helmet. According to New York State law, all bicyclists, inline skaters, skateboarders, and scooters that are used for anyone under 14, they require that they wear an approved bicycle helmet. That was the vehicle and traffic law for the New York State area, that is 123.8. I do think that, also I see so much more. I know I'm a skier, and I'm seeing a lot more people out there with helmets than there used to be, and it's just become part of the attire to wear. I think that's a really good thing, and parents are on board with that and are also found using it as well. When you're assessing a student, again, you want to find out their description of the injury, what caused it, what was the mechanism of injury, did they have any, again, underlying issues before their injury, any, again, loss of consciousness. Elementary school age parents need to be educated, again, on the differences of the 6 to 12 students at risk for concussions. And you want to seek medical attention if is needed, because sometimes our students or parents are seeking that scholarship opportunity. So I find that sometimes they're not always quick to take them to the doctor. They don't want to take them out of their field of play. So I do feel that that is a huge challenge for us. Educating the ER staff to the necessary procedure regarding return to play, return to learn. And again, educating our parents on the management procedures is very vitally important. We will move to a poll question. Does your school district currently have a concussion management program in place?
All right, I'm going to launch that poll question now. Please take a moment to answer the question. I'll give you a few more seconds to answer before I close the poll. All right, I'm closing the poll now and sharing the results. It looks like the majority, 45%, said yes. They do have a concussion management program in place. 26% said somewhat, 11% said no, and then 18% it was not applicable.
Okay. Well, we're coming to a bit of our close of our webinar today, and I just wanted to conclude that on a few things. That more than 80% of the concussions resolve very successfully if managed, like I had said earlier, well within the first 3 weeks of post-injury. The recovery, again, of concussions is best achieved by trying to adapt some type of multidisciplinary team between the student athlete, the family, our school team, and academic team, along with the medical team, which can help the student return to play and learn successfully. No doctor, emergency department, or follow-up clinic, unfortunately, can predict the length of recovery from the concussions, because every concussion is individualized and the recovery time is unique for each one. You may have one athlete who suffered a concussion and their recovery time may not be as long as another child. The type of injury they sustain may be different in terms of the area of the brain that may have been affected, so that may change their recovery. So, it is an individualized thing. It requires everybody's input. And over time, I think that we are all looking out for the best interest of our students, and monitoring them over the long term is so important, because as our brain matures, we are not sure at this point what long-term effects it may have on their learning, how they may behave emotionally, what kind of behavioral issues they may see in the future for them. And I think that that's why it's so important to get the word out, to educate them, and let them know that they shouldn't. They should listen to their body. If it's barking and it hurts, they need to let someone know. I can't enforce that enough. I know every time my son puts on a football helmet today as he plays at the college level, I do worry about any lasting effects that he may have or could potentially have. He did very well academically, so I feel cognitively he's learned to manage his learning well, and he does not experience or seem to experience any emotional issues that I'm aware of. But again, that vote still will be out, and I think that we just have to continue to be aware of it and know that it did happen, or that if a student has suffered one, that we continue to watch after them. So with that, I'm going to close and just share with you that there are so many resources out there. Just to begin with, the Brain Injury Association of New York is just outstanding with what they have available to us. I have a great brain kit that I obtained from them last year that is filled with different books for different age grade levels that I hope to be able to use this fall. I got it at the end of June last year, and I'd like to incorporate it into some type of teachable moment in my own school. I have a book for each grade level. Go in and just get the word out there. Just start talking to children. They're like sponges. They do take it all in. And it will also reduce any scare that they may have or any nervousness that they might experience. Your New York State Education Department, I would think any, and other state ed departments throughout the country. The New York State Health Department here is also very useful. They provide a lot of data. The Center for Disease Control, they are great in providing us with the heads up on clinicians, heads up on coach, and a lot of those different types of resources. The New York Public High School Athletic Association developed a DVD that they will gladly get to your school that you can show at your PTA meetings. Again, it can be showed and viewed at the preseason time of any athletic event as the students start their season. It's a very good portal for information and use. The New York Statewide School Health Services Center, I can't speak enough for them because I use them all the time. They are a great wealth of information for us. I use a lot of their care plans. Nurses can download a sample care plan and try and develop a care plan with the doctor that's specific and individualized to that student who has suffered a concussion. LearnNet is Project Learn continues to help families and children with ongoing support. Ray, I'm going to probably say his name wrong, Ciancaglini, I've had the pleasure of getting to know with my work with the Brain Injury Association, and he is a former middleweight boxer who was heavily involved in the passing of the Concussion Management and Awareness Act. He is a speaker. He advocates for student athletes. He suffers today of some of those lasting effects of the second impact syndrome. And he is always looking to protect our children and to get the word out to children because he feels that he is such a great role model and just a great inspiration for children, and he can really get out there, and he's always willing to come to any school and talk to any forum on this very passionate, passionate cause. Again, the Brain Injury Association gives you their location. They have additional resources. Keep Moving Forward is a DVD that is a great little tool to use as well. The REAP, again, not to reiterate, but we have, they have a lot of fact sheets available to anyone, and you can download them on any of your computers and copy. When in doubt, take them out. That is I have that, in my office. I have it attached to the refrigerator in my office. I use it on my bulletin boards. Your bulletin boards in your schools are great avenues to, reach kids and have them, just take a look. And it's a good way of them learning more about concussions as well. And again, State of the States, the educational needs of children who have traumatic brain injuries, and again, just all the additional information that you have available to you is ongoing. I thank you for your time today. I hope you found this, informative, and that you'll find it useful in your, time as you start your school year. I wish you all the best of luck in 2013, and I appreciate any comments that you may have, good or bad, and I wish you best of luck. Thank you.
Thanks, Patty. Just some quick reminders before we move on to the question and answer session. Some of those wonderful resources that Patty just showed everyone are available on our website. The REAP, the one that was adapted for New York State, is available free for download. So even if you're out of the state, I really encourage you to download a copy of that and use it. Karen McAvoy, she's amazing, and she's actually going to be presenting our webinar in October. So if you're interested in hearing the author of REAP speak, by all means, please continue to visit our website for updates on the date and time. We're working on scheduling that with her now. And she's doing amazing things in Colorado. She's really helped us. I think all of us out there that are working with concussion laws and implementing programs, concussion management programs in our schools, we're all on the same page. We want to protect our students. We want to get the word out there, and collaboration, as Patty said, really is the key. Collaboration and education are the first steps. So I do encourage you to check out our resources. Concussion in the Classroom is another pamphlet that we've created that teachers can distribute to parents or can use to help students return to learn as well as return to play. So by all means, check out www.bianys.org. We are going to start the question and answer session now, but I do want to let you know again that if for some reason your question does not get addressed, we run out of time, please email them to me. I encourage you. I'll be happy to get them to Patty. I know she'll be happy to help. And again, you will receive my contact information in a follow-up email from GoToWebinar. I will be posting the slides. They're up right now, but I'll be posting them alongside the recording, I hope at some point before the end of next week. So keep checking for that, or you can send me a reminder email if you'd like. But I promise they will be up on the website by the end of next week. We will start question and answers now, so if you'd like to type your question in that question box, if you have a question, I will be happy to relay that to Patty. So please take a moment now to ask any questions that you care to find the answer to. All right, it looks like we have a good amount of questions already. Someone wanted to, again, focus on the fact that a concussion does not, typically does not result in a loss of consciousness. So again, it's important for us all to remember that fact. And I have a lot of comments, so this is great. It's generating a lot of feedback here. A lot of you felt it was valuable to mention that some school coaches and athletic trainers are not trained to diagnose concussions, and I think that's where some of the wonderful free CDC training comes in. Some of those resources that Patty mentioned come in there. It is important that we educate our staff and that they are able to recognize those signs and symptoms of concussion to better help the success of the student in the healing process. So thank you for stating that. One person asked about whether or not there are any tracking tools. I think that the tools Patty put up from REAP, those are from REAP, the New York State adaptation, can be very helpful. And the reason that Karen McAvoy designed REAP was she understood that not all school districts obviously have the same access to resources. So REAP was designed to be a cost-effective solution to create a multidisciplinary concussion management program implemented in your school, again, at a relatively low cost. So I think those are wonderful free tools. Again, the REAP is available for download on our website, or you can send me an email if you would like to receive a copy of it, an electronic copy. We do have hard copies as well. If you would like to receive a hard copy, please email me. But I think those are some wonderful tracking tools that, again, are free of charge.
I did want to also mention, I probably forgot to, Carla, if it's okay if I interrupt.
Sure.
There are other assessment tools that I didn't review in length, and that is the acute concussion evaluations, post-concussion. They're kind of initial evaluations that can be used by the MD, nurse practitioners, PAs. There's the impact study. There's also the sideline assessment tools, which assesses on the sidelines. Athletic trainers can use that to assess their attention and memory. It's really not a standalone tool. It really basically will just give them some kind of, assessment as it occurs right at the sidelines. There's also SCAT2, I understand, which is available actually on your iPhone and iPads. It's an app. It's also a screening evaluation that can be used on children 10 years and older. And it's actually it's a score of the SAC and the pneumatic score for baseline concussion management. That can be used also. And simply by you know, again, not to reiterate from Carla, but the symptoms checklist page that is provided in the reprogram, you know, it really, if all of you were unable to really see it up close, it gives you the date of injury, what time it occurred, how the student was 2 to 3 hours later, 24 hours later, 48 hours, and 72 hours later, and then a daily and a weekly. And it provides you with a score, and that actually can, you know, I think it's a great, just, you know, fast thing to look at, the symptoms being headache, nausea, vomiting, balance problems, dizziness, fatigue, and it goes on, it's ongoing, and it will tell you, it gives you a score of 0 to 6, where it's 0, they're not present, 1 could be mild, 1 is not present, 3 is mild, and then moderate would be your number 6, would be, you know, anything that's more severe. So I think that that is a very good thing. I mean, I'm really hoping that I can actually even just come up with my own tracking tool that I just have available at my school, where I'm just looking at the child. But, you know, we don't always have to invent the wheel, but you certainly can use that as a baseline for you to develop something of your own.
Thank you, Patty. And also a lot of the other materials, I think the majority of the materials that you shared were free. I just want to mention the New York State Department of Health materials are also free. So it's nice to use the when in doubt materials. I do have a question here, Patty. This individual services some smaller private schools that do not have a school nurse full-time, which obviously, as you can imagine, creates an issue if a student is hurt when the school nurse is not there. Do you have any suggestions other than educating administration about TBI? This person feels it's difficult to know if protocol is followed in the absence of the school nurse.
In terms of it being a private school, I can speak from my own experience that we do now currently have one private school in our district, and they actually do follow a lot of the policies and procedures of our district. On the note of not having a nurse, that does pose a very difficult question, because you would be, you know, stuck with having to call, you know, either the parent or 911 if it was severe enough. I think that for the, you need to check with your local public school to see what kind of concussion management program they have in place, and you should speak to your administrator, your phys ed teacher in the private school, to see that they have a concussion management program protocol that they can follow. And probably in that kind of a setting, you have your work cut out for you, that you really do have to stress the education piece. Talk to your teachers, talk to your administrator, talk to the gym teachers, so that they really do have an understanding of concussions and how they need to manage it within the school. I think that would be my approach if there was no school nurse in my building. It does fall on if there's no school nurse in that building, or if it's like a floater, a floating nurse, that is, you would still have to have some kind of procedure in place. In the state of New York, they're saying that we have to have some type of policy in place. Understand that if they don't have those available resources, then you have to come up with some other type of protocol and procedure to follow. So you may want to work with your administrator on that to see what kind of, you know, management program that you can put into place to ease the parents, and also to make your job easier to follow the procedures appropriately for that student.
Thank you, Patty. I have a few questions that are of similar nature. One is about programs or sites for specific coach training. Another is about educating PE teachers on the gradual return to play. Again, for these questions, I would really encourage you to revisit the slides. I will have them posted. They're posted right now, actually. I will have the recording posted as well on our website, www.bianys.org. I encourage you to revisit them. There's a lot of great resources on there. Again, a lot of us are on the same pages here, so whatever information we can share with each other is extremely beneficial in this process. But a lot of the CDC training is great for coaches. I would check that out. I would, again, revisit the resources. And as far as the program goes, I would definitely utilize Karen McAvoy's REAP. We've heard great things about it. Knowledge about it is spreading rapidly. So I would encourage you to get your hands on a copy, whether it's electronic or you want to receive hard copies from us. I would encourage you to try to use that. It really creates a great multidisciplinary system. And there's some resources, other resources listed within the REAP packet that weren't mentioned today as well. So that's basically the best advice I could give at this point for those particular recommendations. Another attendee wanted to know more about the FACTS program, the Brain Injury Association of New York State's FACTS program. That's a program set up in New York State that provides advocacy services and a support system for individuals that are injured prior to the age of 22. So it's a wonderful way to link your student up or your child, or whoever's been injured before the age of 22 with an advocate that can kind of get in the school system, help out, provide that needed advocacy and those additional services, and someone who's very knowledgeable. You're linked up with someone who's very knowledgeable about local resources. So the FACTS program is another great free resource. We are running out of time, so I have time for a few more questions here. Patty, this question is, do you require a doctor's note for academic accommodations? I think this was talked about a little bit briefly, but if you wanted to elaborate.
I did talk about that a little bit, and I would say yes, especially I know for us here in New York, when it comes to any of the standardized testing, we do have to have a written note from the physician regarding their academic progress, and they may have to be more specific. And you as the nurse can work with the educator and the educators to see what would best benefit the student. And it is important that the doctor, unfortunately, he may have to be more specific. There was there is a children's hospital actually that has a great is a great resource. I'm trying to remember which one it was, that provides a good understanding of what educators would like to look for and how specific a physician would have to be. But again, I would probably reach out to your medical director or the primary care provider to say that you need more more permission, that the child needs to have a more specific note from them regarding possibly the accommodations. It says, it has to be specific that the student can't participate in physical activity. It might include their gym class, weightlifting, any kind of sports, and then also, if they have to be absent from school, or if they can have to go in for just a half a day. So that definitely, I would say you need to talk to your primary care physician. And I do think that I can only speak for myself. I know our primary care provider, he does go through helmet safety and all that with my children at the beginning of the school year at all of their physicals. And I do see that is changing. The climate definitely is changing in the culture of, children who experience brain injuries or have a concussion. And they're taking a more proactive role. Yes, they do have a practice. If you are going through the medical director, within the school that has been assigned to the school, they also do have a practice as well. So it may take a while for them to get back to you, but you certainly, with faxes and stuff, they should be able to provide you with the necessary documentation to excuse the child or provide accommodations for them.
Thank you, Patty. I just want to say again that the discussion that's happening right now with the Q&A is really great to see. And unfortunately, we are running out of time, so I'm going to take this moment to answer the last couple of questions that we can fit in here. We're a little over as it is. But please, if your question wasn't addressed or you have a resource that you want to share with everyone, please send it to me. Again, you will get my contact information in a follow-up email. I'm also getting a lot of people saying they're having trouble finding REAP. What I'm going to do is when I post the recording of this webinar, I will also post REAP along with it. So I'll post the slides, the recording, and REAP together. That way you guys should all be able to find it easily. If you're still having trouble, by all means, please email me, and I will be happy to get you those materials. The last questions I'm going to take, one is about obtaining teacher observations of student symptoms. Again, I would refer you back to the REAP pamphlet, which I will, again, post along with the recording. There's a great handout that Patty shared that is an easy way to kind of monitor students' symptoms in class. So I would encourage you to use that. The last question for you, Patty, is do you have suggestions for non-school supported activities? And I know in New York State the law doesn't require private schools to necessarily follow the mandates there. But do you have any suggestions for non-school supported activities such as community-based sporting events? Or do you know who would be responsible for training or educating volunteer coaches?
I think you'd have to look at the organizers of those particular sporting events, such as I would say like in the soccer. If you have an established soccer program, your baseball programs, any of your established sporting programs within your town, in your state, I would think and I would hope that as you know, all of this is catching on, that those organizations are establishing some type of concussion management, or at least cognizant of it, are providing parents again with any information from the CDC or any of our the aforementioned resources. And if not, I think it's something that as a parent I would probably address, especially with today's children who are starting at such young ages in a lot of these sports. I mean, take Pop Warner football, for instance. I mean, these kids are starting out very young. We know that that's a vulnerable age. So if you don't think that there's one, I think I would seek it out and see. And actually, that's a good question. I believe that I will even myself try and reach out to some of our organizers in my own town to see if they have something that's formal. Or has been established within their
Patty,
different...
not to interrupt, but do you know of any assessments for our younger students, preschool and under 10 years of age? I know you work in the elementary school. Okay, so that's another issue.
Yeah, I guess, I don't know of any. But certainly for myself, now, since I've been at the elementary school, I am seeing more, some head trauma that does occur even on my watch. And it has... driven me into that.
I'm told SCAT 3 has a child assessment now, so I'm told SCAT 3 has a child assessment.
SCAT 3 does. SCAT 2 and then SCAT 3 is not available yet as an app on your phone, but that may happen soon. So they may be. I think they may have mentioned that at that last CASDA's conference, the athletic trainer, that SCAT 3 was going to be coming out, if not already. And they may have one because the
and
other
possibly
one is
CDC might have a checklist. Okay, well, I'm so sorry to cut things short. Again, I love the conversation that this webinar has generated. So thank you again, Patty. This does conclude our webinar presentation, unfortunately. I hope you all found it as informative and educational as I did. Thank you all again for participating. Please spread the word about our monthly webinars. Again, we have a lot of wonderful resources. If your question wasn't answered, email me. If you can't find a resource on our website, email me. Thank you again, everyone, and have a wonderful day.